Hi, everyone. Today we have another co-author spotlight of the book, How Healers Heal. We have Dr. Prachi Garodia. We're going to let her introduce herself. Hi, Dr. Prachi.
Hi, Shilpi, Dr. Pradhan. How are you doing?
Good.
Yeah,
Please tell us a little bit about yourself and where you are located. What do you do?
yeah. So I'm located at Miami, Florida. I am the clinical director and section chief of Whole Health, which is more of the integrative, whole person centric approach to healing at the VA. So that's where I am. And I do a lot of other things on the side, like, writing, co-authoring this book. I've trained extensively in integrative medicine. My journey started really early in childhood when I was growing up amidst yogic, Ayurvedic, homeopathic treatments and modalities and more natural living. And that really inspired me to learn more and be open and curious. So after I did my board certification in internal medicine here in the US, I went back to India and I trained extensively at that time in Ayurveda, yoga, various types of meditation practices and styles, and also acupuncture. And then when I came back here, then I felt a little bit much more confident in offering all of those tools to our patients here.
I love that in your chapter where you go into how you were motivated to go back and how you were supported and learned and furthered your training. That's amazing to take all that time to do all the additional training that you've done. So let's just focusing on lifestyle medicine, because I know all of the training you've done actually lends itself well to your lifestyle medicine practice. But how did you get introduced to lifestyle medicine? And I know you integrate it all so well. So you can tell us a little bit about how you integrate it into everything else that you're doing with whole health at the VA.
Thank you. Yeah, very relevant question here. So once I trained in Ayurveda, Ayurveda is more like the mother of lifestyle medicine. It's ancient. Our ancient saints and seers and scientists of those times actually very finely observed the life cycle and the practices which help with longevity and well-being. And so all of those practices, a lot of them don't have evidence. So I was still looking for a lot of evidence-based. And when lifestyle medicine came out, maybe around a decade back, that's when I got to know about it. And there was a lot of evidence and research backed into the 6 pillars of lifestyle medicine, including nutrition and sleep and movement and activity. So all of those were being researched really well, and there was a lot of, scientific proof there. So that really drew me to lifestyle medicine. And also, similarly, the whole health approach is very person centric, very similar to Ayurvedic practice. So it treats a person as a unique individual and utilizes a lot of those lifestyle pillars too in the healing process. And definitely a lot of stress on relationships and connection, your spirit and soul and the surroundings, both internal and external surroundings. So all of those things together really, really offer a very conducive and very healing environment for the person. And that's how I integrate it in my practice. It's pretty seamless, it's very, very personal centric. I also look at the energetic aspect of it and the spiritual inclination of the person too. And at Lifestyle Medicine, ACLM, I'm also one of the co-chairs of the Happiness Members Interest Group. So positive psychology and science of happiness is one of my passions and calling too. And obviously the science of connectivity and heart coherence and, all of that. So I've trained extensively also in, like, for example, biofeedback and clinical hypnosis and a lot of the other complementary and integrative health modalities, which I integrate in my practice, in my regular practice too. So all of these tools really provide a full, multifaceted healing tool to the patients who come in.
That sounds so amazing for your patients and for the VA. Can you tell me a little bit more about the whole health program? Is it available at all VAs or only at your VA?
Yeah, thank you. Yeah, it's the cultural transformation of health, well-being, and healthcare, which the VA has started approximately in 2017. And it is available at all VAs, even though the implementation is at a different rate and a different phase at each VA facility. So, for example, some VAs have all the required staffing for offering the complementary and integrative health modalities. Some facilities will refer out to the community. Like, for example, if they do not have a person who will offer the clinical hypnosis, or a provider who might not have biofeedback training, so they'll refer it out to the community. But overall, it's very, as I said, person-centric. So it's me in the center. We really teach both the providers, the staff, the employee, mindful awareness practices. So being present in the moment and non-judgmental, and then train them, all of us, to engage and really equip the veteran or the person in front of you, connect with them as a human being, and then train them in self-care practices. And then finally treat, we do conventional medicine really well otherwise, but some additional modalities are brought in to give a more of a holistic healing to the person, depending on their needs and the evidence which is available.
That's just amazing. I love that. So that's so great that it's available at all VAs. Do they allow you to do it virtually as well, as in terms of out of state?
Yeah, well, there has to be a sort of a MOU or a tie-up between two VA facilities if you want to do it out of state. But definitely within the facility, you can do it virtually. Like, for example, I do clinical hypnosis session and biofeedback sessions virtually for most patients, especially since COVID started before. And obviously things like acupuncture have to be done in person. Same thing with massage therapy has to be done in person. But yoga, tai chi, meditation, all of these practices can be taught and guided over virtual modalities. So it's really, really nice. And the good thing is the VA trains a lot of, most of its staff, and makes them capable of offering all of these modalities too, depending on your interest and your scope of practice.
Wow. So can you tell me some success stories about, let's just pick acupuncture and hypnosis without obviously getting into patient details, just very, very general comments about those two modalities in particular.
Sure, totally. So I'll just give you a very, very brief example. I'm also an instructor for battlefield acupuncture, which is a 5 small needle protocol for the ear. And so one of my patients came in with 8 out of 10 low back pain level. And he was really desperate. He had tried everything, including injections, very young. He was like 28, and he did not want to go the medicine route again. He had been on opioids for a short while, really felt, totally like a zombie, and he did not want to go there. So he was like pleading, and I had just finished my training for battlefield acupuncture at the time. And I bravely just say, okay, let's try something else. And he walked out with a level of 2 out of 10 pain after a 10 minutes treatment. And that was really amazing. Like, that was my first case, which I did. And that really made an impact and convinced me when I saw that benefit in front of my eyes. Similarly, I've treated patients with PTSD, anxiety, depression, low self esteem, and with clinical hypnosis, and even a patient with bulimia who came in and she said, okay, I've heard about clinical hypnosis. I want to try it for my bulimia. I said, okay, well, we'll see how it goes because there's not much evidence, but we can definitely try. And it really worked for her. It supported her in her journey to sort of recover from that eating disorder. So, and built up her self-esteem and sort of had her face some of the past things which she was sort of escaping from, the past traumas in her childhood. So very intriguing stories, and it's every day, like you learn something every day from people all around you, including your patients and your colleagues. Such a wonderful journey for sure.
That's amazing. I mean, the world needs people like you and doctors doing what you're doing to help in more of a rounded way. That's simply amazing. And I know you're focused on all the pillars of lifestyle medicine, not just stress management, but it sounds like all the modalities you're doing focus on all the pillars as well. Okay, I'm going to switch gears a little bit to the book because I think I could talk to you about this forever. But so the book, How Healers Heal, I'm sure you've read some of the other chapters, which are just simply amazing. Your chapter is wonderful. People need to go out and read it. Why should doctors read this book, and why should patients read this book?
Thank you, Shilpi, for asking that question. I think doctors, we all sort of burnt out and fed up with the conventional setup and, the pill model and the illness model rather than looking at the wellness and the well-being model. And with limited time and really not looking at the root cause of disease. I think we're just fed up with that. And so is the consumer and the patient. So I think both of us need to be inspired, both population needs to be inspired and reconnected back to true healing source. So definitely it's a source of inspiration when you look at so many lifestyle medicine doctors being impacted strongly both in their personal lives and in the patient well-being and other stories of recovery and healing. So I think it's really, really inspirational. You get a lot of tips, like every chapter, you can glean something really small and take home as a message or an inspiration. That worked for that person. Let me see if this might work for me. So it opens your mind, so I would encourage everybody to be open and curious and definitely be on the lookout for tips and tricks in there.
Thank you for that. So yeah, patients, doctors, everyone can benefit. I think this book is just phenomenal. So what is your number one tip for someone looking to make lifestyle changes today? Someone who can't come visit you in Florida at your facility? And what do
Yeah,
you do in your daily life for your number one, like self-care?
my go-to number one, because I started this practice pretty early in my childhood and also trained extensively in yoga. Um, the whole philosophy of yoga during my medical college is practicing meditation and yoga. And yoga is not just postures, but it's much more beyond that. And in fact, I'm writing a book on something similar to that too, about the happiness and the yoga and the different practices which are in the whole philosophical approach to the connection of yoga. So I do yoga practice and asana, which is a posture, and breath practice and meditation, typically in the morning and longer on the weekends. And then at nighttime, I do a yogic sleep practice. That is also amazing to have really good restorative sleep and, a lot of good restful time at that time. So my takeaway would be for each person to really look and ask themselves as an introspective question, what is it that I want in my life? So looking for the inner meaning and purpose and introspecting on that and being true to yourself, not just like making it up in your mind. And then looking at what direction we might need to move to, or maybe just shift the dial a little bit. And I would encourage everybody to always start with the small baby step So make a short-term goal and maybe make a SMART goal. So, specific, measurable, action-oriented, realistic, and time-bound goal. And then take a small step forward after that. And there will be failures. We all are humans. We are set to that. We all of the past uh, the settings in our brain need to be changed a little bit by little bit. And that's what the magic of and the science of neuroplasticity tells us. It's a little shift, and then new pattern starts forming. And that's what we are basically walking on in this life's journey. So that'll be my takeaway. Start small, make SMART goals, and definitely start with introspection and looking at your deeper meaning and purpose in life.
Thank you. That was wonderful. Do you think you could teach us the nighttime routine quickly, or is it very extensive?
It's a progressive muscle relaxation. So you basically connect. It is a little longer. It's a 15 minutes practice, but I can, just basically do a nice gentle body scan, the connection with the physical, then the breath, then the emotions. So I do practice gratitude also at nighttime. So it might be 15 minutes, and maybe we will save it for some other time.
Yes, we'll look for it in your book, your upcoming yoga book too, but that's amazing. Thank you so much. Is there anything else you want to mention? And of course, I will list your links to your to ways to connect with you, but anything else you want to mention before we wrap up?
Sure. I mean, just a very small thing. I've discovered the power of gratitude, compassion, forgiveness in the last couple of years, after a long journey. And we go up and down as humans. We move forward, then we move backward, we move sideways, we take a detour, and that's life and its journey, and we just learn how to be accepting and sort of non-judgmental of ourselves. So, what I would recommend is start to open up the heart again, because most of the time our hearts have learned to get closed and walled up. So, I would encourage everybody to start doing more of the heart-centered living. And then for connecting, I have my website, which is www.drprachigarodia.com, and also have several social media handles, which I'm not very active on right now. Trying to move away from a little bit of the social media too much time, but I am available there.
That's so wonderful. Thank you. I was making notes about all of the things you were saying because you've just dropped so many nuggets and they're totally quotable, and I'm going to add them to your page. Thank you so much, Dr. Prachi. It was wonderful to meet with you. Everyone go check out our book and check out Dr. Prachi's chapter.
Thank you so much. Very, very grateful to be here and so excited about all of us coming together and writing this lovely book. Thank you.